listening to 40 Weeks, a production of the Pregnancy Podcast with Vanessa Merton. Visit pregnancypodcast.com/week for all of the 40 Weeks resources and sign up with your due date to get each episode delivered to your inbox when you start a new week of your pregnancy. Thank you for tuning in to the 40 Weeks podcast. Welcome to week 32. Only 8 weeks to go. You can see a picture of what your baby looks like this week, read the transcript, and access all the additional resources at pregnancypodcast.com/week32. Your asparagus-sized baby is growing to about the size of a cantaloupe. They measure 16.9 inches or 43 centimeters and weigh 4.3 pounds or about 2 kilograms. Your typically energetic baby may start to chill out a little bit. Their movements are going to feel more like squirms and rolls than hyperactive kicking, and that's because they have less room to stretch out and move around. They will gain a third to half of their birth weight during the next 7 weeks. Their digestive tract is almost fully developed and ready to digest milk once they're born. By week 32, your baby could detect a stroke of a feather. Early in pregnancy, babies move away from touch. As they grow, they will respond by moving toward touch. One study showed that babies responded to touch more than voice by moving their heads, arms, hands, or mouth. You can apply touch by gently stroking your belly or massaging your stomach with very light pressure. And for more ways to bond with your baby during pregnancy, visit pregnancypodcast.com/bonding. Your uterus now rises 5 inches higher than your belly button, and it's still expanding. Since you became pregnant, your blood volume has increased 40 to 50% to accommodate your and your baby's growing needs. In your prenatal care, if a question about fetal health and well-being comes up from an examination, from symptoms, or if your pregnancy is high risk, your care provider may recommend a biophysical profile. This is a test to determine fetal health that can take place after 32 weeks. This combines an ultrasound with a non-stress test where belts are placed around your belly to measure fetal heart rate and contractions. Ideally, your baby gets in a head-down position before birth. They're facing your back with their chin tucked to their chest and the back of their head ready to enter your pelvis. This is called cephalac presentation, and it's the position that most babies will settle into in weeks 32 to 36. If your baby is currently breech, it's an excellent time to talk to your care provider about either using interventions to try and turn them and the optimal time frame to employ those interventions. An external cephalac version, or an ECV, is a procedure in which your doctor or midwife puts pressure on the outside of your belly to try and get your baby to turn head down. The American College of Obstetricians and Gynecologists states that the preferred time for an ECV is after 37 weeks. There's some research that shows that an earlier ECV, between 32 to 34 weeks, increases the chances that your baby will be lying head down at full term. For more evidence on breech babies and an external cephalac version, visit pregnancypodcast.com/breech. Many mothers also swear by spinning babies, and you can learn about the evidence of this method in an episode on optimal fetal positioning and spinning babies. You can find that at pregnancypodcast.com/spinning babies. There are claims that there's a diet that makes your labor easier, creates a smaller baby, and results in a less painful birth. This is the Leuven diet or Lowen diet. It is a German last name, so I'm not exactly sure how to pronounce it. This diet restricts high glycemic foods from week 32 until birth. To learn more about this diet and others during pregnancy, visit pregnancypodcast.com/diet. One thing to keep in mind as you're getting closer to meeting your baby every day, after your baby's born, you have one last stage of labor, and that is to birth your placenta. As with everything related to your labor and birth, you have options for this third stage. Expectant management is without interventions. Active management can involve medications and some physical interventions. Advocates of expectant management argue that the natural process that your body goes through promotes the normal separation and birth of the placenta and that it minimizes complications. Proponents of an active approach argue that active management is quicker and results in fewer complications. So which is the better approach? For a breakdown of all of your options and the evidence on the third stage of labor, visit pregnancypodcast.com/third stage. A tip for dads and partners. Back in the 1950s, dads spent labor in hospital waiting rooms called stork clubs, and they hung out in there until a nurse came in to tell them that they were a father. Today, dads and partners are active participants, from planning during pregnancy to catching their babies at birth. Get on the same page with mom about the role that they want you to play during labor. And if you need help, there's an episode on preparing your partner for birth that breaks down labor step by step and details what you should be doing at each stage. You can check out that episode at pregnancypodcast.com/birthpartner. Thank you for tuning in to the 40 Weeks podcast. You can see the full transcript and all of the resources for week 32 at pregnancypodcast.com/week 32. Next week, your baby gets its immune system. Until then, I wish you the very best in your pregnancy journey.